So I'm Mandy Reeve. I'm a TA specialist at the PDG B-5 TA Center at SRI. I support regions 5 and 6, and I'm excited to be here today with Richard Gonzalez and folks from New Hampshire and Vermont. We're really excited to talk about this great content with you. So today we're going to talk a little bit about the documents themselves, just a little bit of basic information, hear from New Hampshire, have some breakout time to talk about the APPR, hear from Vermont, and then wrap up. We hope that by the end of the session today that you hear about the purpose of the strategic plan, PPEP and APPR, that you learn about how those documents are intended to be aligned. You learn about some of the changes to the APPR and connect with each other on strategies and data sources, and that you learn how 2 states are aligning their strategic plans, PPEPs and APPRs. So it's a lot to get through, but I think we're gonna have a good time. So we're gonna start out today hearing from Richard Gonzalez, who is the Director of Interagency and Special Initiatives within the Department of Health and Human Services Administration for Children and Families. He is our Federal Project Officer and fearless PDG B-5 leader, and we are excited to hear from him. Go ahead, Richard.
Thank you. Hello, everybody, and thank you for joining this session. A lot of what I'm going to probably say, you may already have heard me say before, but hopefully in this context, it will help with the flow of the conversation. So the requirements of the PDG B-5 were for you to do these four documents, right? You started with a needs assessment. You had to create a related strategic plan. We told you that you needed to submit a program performance evaluation plan. And then we said at the end of the years with the renewal grants, you would have these annual performance progress reports. And I want to talk a little bit about the fact that this goes beyond the requirement. So yes, you had to submit them to us. They were deliverables for the grant. But when we created this expectation and when we gave you funding to work on these tools, the intent, the dream, the purpose was to really be useful to you as a state. In the end, if the time you spent, the effort you spent on the needs assessment to understand better what was needed within your state so that you could create a meaningful strategic plan, a meaningful vision for your state, and then a program performance evaluation plan, or the way you were going to determine whether the funding, the outcomes, the work being done, the activities being taken were really being effectively met. And I've said this before, but the reality was, yes, thank you for submitting it to us and meeting that deliverable obligation. But ultimately, if you don't do the work that's necessary to make these alignments, then in effect, you will not make the same progress that you need to make toward the activities and goals that you see. And so we put this together with this idea that these would be really helpful tools for you. And they would not, although you were only required to deliver them to us once, we still see these as living documents, living processes that you would be using and over the course of this grant, and hopefully continuing to use these tools and these processes even way beyond this grant. So the idea of continuous assessment, continuous strategic planning, continuous evaluation of the work and the outcomes and the progress being made so that you could make the necessary changes. Now, the annual program or performance progress report was a little bit different. We needed to have a way we had basically a federal purpose and we had a state purpose. The federal purpose was because up until now, we really don't have a good way of collecting data across states. So when congressional members and leadership would ask us, what could you tell us about whatever the data was? What could you tell us about across states? We really had difficulty doing that. We could ask you to submit something, but we didn't have a way of looking across states and telling the story. And so for us, the original APPR, which was due last year, was our attempt to identify data that we thought you either were able to collect already or would be able to collect by the end of the 3 years. And we assumed that this needs assessment, strategic plan, and program performance evaluation plan would help you make the determination of what adjustments you needed to make so that you could begin to collect this data and share that information with us so that we could better tell the story. At the time, what we put together was pretty much trial and error. We basically said, let's put together these data questions. Let's ask the states let's see what they submit to us. Let's see if these are the right questions to be asking, because we weren't even sure that they were. And so that first year of APPR was really for us a trial period. It was a chance for us to look at the tools, try to determine whether or not the questions we asked made sense, whether the guidance we gave made sense, whether the data we asked you to collect was data you could collect and made sense, and that we could in effect use it. I'll talk about what we're doing this year in a moment. But the purpose for the states was really for you to begin to look at the data we were asking you for, but was this data that was meaningful to you? Was it the data that you needed to collect based on what you did in a strategic plan and a program performance evaluation plan? Or was there a whole different set of data that you should be collecting regardless of what you submitted to us? And so begin to evaluate the data that's going to support your strategic plan and your evaluation work. And so those were the two purposes. And you'll hear a little bit more about this now, and you'll hear a little bit more in the closing session. But what we did is we took your feedback on the APPR. We decided to listen to recommendations you made. We evaluated the data and saw where there were inconsistencies, either in the guidance or in the work that was being in the data that we asked for. We realized, well, maybe we can't really use this in a meaningful way. And so we've changed the format for the APPR going forward. And you will see that we're really now focusing on basically 8 core questions that we're going to ask you to answer. And in answering them, to provide the data, tell your daughter's data story with the data you are collecting that you have deemed is important for you. And then we can share that data going forward. So what you see here on this purpose slide is pretty much what I've just said, really, right? Strategic plan describes your accomplishments. The program performance evaluation plan includes what's going to help you examine the implementation outputs and costs, and the annual program performance report, regardless of the format, is going to help us collect information so that we can share this information with leadership. We can make better decisions at the federal level for future funding opportunities, and we can look for what the data that you're collecting and determine how helpful it is for us to make better decisions in funding you. And hopefully at the same time, you're using this tool to better tell your story and to determine what data gaps you have and what data is really meaningful for you. So that's really kind of my overview of the purpose, what we intended from the beginning. Again, I will leave you with the fact that if it's not helpful to you, it really didn't do what we wanted it to do. Because thanks for submitting it to us, and we accepted it and we sent you notices, but it really was intended to be tools that were going to move you in the field farther along. So thank you. I'm going to pass it back to Mandy now, so she and the team can take us the rest of the way.
Great. Thank you, Richard. Okay, so I am going to use some metaphors and get a little cheesy and walk through some of what Richard just said in a little bit more concrete way. So sometimes when you're managing a large grant initiative like PDG B-5, it can be difficult to see the forest for the trees. You've got 5 activities, 6 activities. They all have to live in buckets. You have a budget for each one. You have contracts for each one. There's a lot of moving pieces, a lot of spinning plates. You have to keep them all balanced. And so it's really easy to think about a grant initiative like PDG B-5 in terms of its trees. It's little buckets. Each one is individual. Also, there's a chance that you came into the grant program in your state later than it started, and all you've ever known is these buckets and these trees. You've never sat down to think about the big picture or the potential forest that these trees live in. Those of you who've been around from the beginning probably haven't thought about the forest your trees live in for maybe years, because you've been so engrossed in contract management, contract administration, all this new COVID-related funding coming into your states. And so it makes sense that sometimes you see your activities as trees, but really your trees live in a forest. And if you think about how PDG creates this forest, Your needs assessment and your strategic plan, like Richard was just mentioning, sets your foundation. It's the soil. It's what everything grows from. It helps create the trees. It helps create everything about the forest. My animation. And then you have the programs and activities that you put into activities 3, 4, and 5. The ways you're helping parents become empowered and engage in their children's early care and education, where you're improving the quality of all the programs and services in your comprehensive early childhood state system, where you're sharing best practices among providers. And you're doing all that so that your system will be improved. Your trees will have beautiful green leaves, flowers, maybe even apples, right? So you'll have this great, beautiful trees in your forest. Because as part of the entire ecosystem of the trees in the forest, you want children ready for school and families to feel supported. So I know this is a little bit cheesy. My animation didn't go super smooth, but this is the idea of how all of these things are linked together to create a whole forest or a whole early childhood care and education system. And that ecosystem is supported by this cycle of needs assessment, strategic plans, program performance evaluation, and then your program performance report. And all of these things circle around your ecosystem and your forest to make sure that it's growing the best that it can and that everything is aligned together. So with that, I think we're going to transition over to Brittany. If you have any thoughts or reactions to that, feel free to share them in the chat. We'll have more discussion time as well. I think I'll hand it over to Faith to introduce Brittany, and I will stop sharing.
Excellent. Thank you so much, Mandy. It is my pleasure and honor to be able to introduce Brittany and Dylan. I have had the pleasure of working with New Hampshire and with them on their early childhood integrated data systems along with Missy. You'll have to excuse me, I have a cold. It's that change of season time of the year. So I'm getting a little winded, so please forgive me. But I'd like to introduce Brittany Little. Brittany works for the University of New Hampshire as an early childhood integration specialist, supporting the New Hampshire Department of Health and Human Services. Brittany has been with the New Hampshire Department of Health and Human Services for almost 4 years, starting with her Master's in Social Work internship with the Bureau of Housing Supports. In her time with DHHS and in the PDG, Brittany has facilitated their early childhood integration team, developed visuals to increase understanding of New Hampshire's early childhood system, completed environmental scans on specific topics such as services for children whose parents have a substance use disorder and family engagement. Brittany has led New Hampshire's 2020 APPR process and is currently leading this year's process as well. And she is joined by Dylan Gata. Dylan also works for the University of New Hampshire with the PDG grant as a shared business systems analyst. And she goes between the departments of New Hampshire Health and Human Services and Education. And she's a staff member for New Hampshire's Early Childhood Council, the Council for Thriving Children. Her main focus with the PDG work is helping New Hampshire plan for an early childhood integrated data system, but also supports projects with the Council for Thriving Children, like the statewide Early Childhood Strategic Plan. When she first started this position, they used the APPR as a way to begin learning about the different programs and data systems in New Hampshire's early childhood space. And since then has used it in planning for the ECIDS and identifying specific metrics for a strategic plan update. We are so glad that you ladies are here to share your process with us.
Thank you, Faith. I will go ahead and share my screen for today's presentation. So first, thank you to PGTA and for Richard for including us in today's presentation. I am Brittany, and I am here today with Dylan, and we're going to talk all about how in New Hampshire we have used our PPR really as a tool for our state's early childhood system. So we're going to first walk through this type of process where Richard really laid out the overview of the PPR. And then I love Mandy's visuals as well of what it looks like in the grand scheme of things. Dylan and I are going to walk you through what New Hampshire's early childhood system looks like, we're going to share what our planning and implementation processes look like. And then the part that I think is most exciting is we're going to talk about how we have integrated our PPR not only in PDG activities, but to other early childhood state initiatives. And before we get started, I do just want to do some level setting regarding the New Hampshire team. So we were able to use our PDG funds to really build a diverse team that's able to focus on different parts of the PDG. And this diverse team allowed it so that I could work on the PPR basically full-time the last 3 months of last year in order to submit. I know that most states don't have the luxury to have someone work on this full-time, but my hope is that our presentation still allows you to see some ways that you can move forward in integrating your PPR, not only with your other PDG activities, but with other initiatives in your state. And I want to start by giving you some context about New Hampshire's early childhood system. This is really looking at, if you're very familiar with last year's PPR, it's that question A1, what programs are in your mixed delivery system? This is where I really think we were able to dig into what makes sense for New Hampshire and how do we define our own early childhood system. And that's where we came up with this criteria, which really kicked off the rest of our PPR process. So on your screen, you can see what our criteria is, but I really want to draw your attention to that third bullet where it says children birth through age 8, which is different from the PDG, which is birth through age 5. But we intentionally made that change because that better aligns with how our state defines early childhood. And then some examples for that final bullet where it says provide system and program support or oversight. Those are our programs like our Head Start Collaboration Office, our Child Care Licensing Unit, and then many of our Department of Education programs don't actually provide services directly to children, but rather provide support and oversight to the districts that provide those direct supports. So once we had that, really the foundation in place, we were able to dive into our planning process. So we worked with our state partners to define what our early childhood system even was. So that included that criteria, which we just covered, but also those key definitions within the preschool development grant, such as low income, rural, vulnerable, and underserved. And we even went back to our state partners within those two departments to say, do these definitions align with what you're already using and implementing within your own programs? We developed a flexible timeline, which I am very glad now as we are all in the season of pivoting and exploring this new PPR process. With that flexible timeline, we were also able to start early, which I'll talk a little bit about in further slides. In our planning process, we also broke down our PPR into a little bit more manageable sections. So we broke them into narrative, which is really when we would ask programs, what are your definitions? What actions are you taking to serve more children and families? And questions related to quality. Data is really basically that entire section B of last year's PPR. Fiscal, I don't think we need to go into any description about that is, and then system, thinking about things like coordinated application and data integration. And then finally, the thing that we implemented within our planning process, which I think allowed us to save a lot of time and a lot of energy, not only with our PDG staff, but any stakeholder that we engaged with, was the development of templates and FAQs. So when I say templates, I mean things like, how are you going to send the same email to every single stakeholder when you reach out to them for information? So everyone has the same access and awareness to what you're asking them for. So templates like canned emails, templates in terms of what data you're requesting, and then developing FAQs. We started our foundation of our FAQs just using information available either in the PPR description or in the guidance we received from ACF or TA. And then as we engaged with more programs and more stakeholders, we were able to really tailor our FAQs to make sure they align and make sense for our state. And our implementation process, I think this is, again, another key part of how New Hampshire has been able to integrate our PPR into many activities. So from the very beginning in our implementation process, we have been partnering with leaders and programs to ensure basically every part of this process aligns with their work, their goals, and our overall early childhood system. From the very beginning, we have implemented a two-way street with any program or stakeholder that we requested information from. So if they were filling out the template for their narrative responses, we would say something like, flag any questions that you think would be helpful or powerful for you to have access to with all the other programs that respond to the PPR. I'll go into a little bit more depth when I talk about integration, about how that has really served New Hampshire. Connected to that is aligning with state initiatives and goals. I'll go more into a few examples of how we were able to do that in between our PPR processes, and then more so this year. An important note, these two things are just lessons learned that I wish I had realized sooner. So number one is to track all decisions that you make. This is just going to make it so much easier to understand what your data is, what it is saying, and how you got there. And for those of us who are really in the thick of the PPR process, I think it's extremely important to remember to take a strengths-based and growth-focused approach. So celebrate the data that you are able to collect, that you are able to provide, and that really makes sense for your state, and use those to really leverage or fill any gaps that you find along the way. So the exciting part, again, I think this is what I get most excited about when I think about our PPR, is this integration. So we're going to talk about integration in two ways. First, we're going to talk about how our PPR connects to other PDG activities. And then we're going to go a step further and talk about how we have connected it to our larger early childhood system. So I'm going to talk about how our PPR connects to our PPE. There's so many acronyms, so I'm going to try to keep them straight, but just stay with me. So within the first year, our PPE referenced our PPR as a tool and a component of our state's data integration and cross-department coordination work. Right, like Richard said, our PPE is a living and breathing document, so it has evolved over the years. So it now directly aligns with our strategic plan, which Dylan is going to talk about in just a moment. But it's also going to evolve even further to connect to PDG, our year 3 community grants, which is a huge initiative in our state for the final year. But that still connects to our PPR because it's going to look at things such as sustainability, governance, and efforts to better coordinate programs, all of which are questions that directly link to our PPR. I'm going to now pass it to Dylan to talk about how our PPR and our strategic plan are connected.
Thank you, Brittany. So for our strategic plan, this year we set out to update some of the metrics in New Hampshire's early childhood strategic plan. We wanted to make sure that the metrics were based on data that was currently being collected and data that would be available to include in our update. And we wanted to identify one particular North Star metric for each of the different objectives. So as a starting point, Brittany did a crosswalk of data from the PPR and how they aligned with the different objectives in our strategic plan, which was really helpful because it helped us know what data were readily available at the time. And so ultimately, our strategic planning committee pulled updated metrics from the PPR as well as from other sources. But some of the examples of the data that we ended up using from the PPR include the number of children enrolled in specific programs within our early childhood system, such as like WIC or free and reduced lunch, preschool special education, and Part B and Part C services, and the number of licensed providers. Brittany, you can move to the next slide. So in addition to aligning our PPR with PDG activities, we also wanted to integrate it with our state's early childhood system in an effort to make this more than a requirement. So here we're going to share a few examples of how we have done that. First is with the data integration and for planning for New Hampshire's early childhood integrated data system, because the PPR has been helpful in the ECIDS planning because it showed which programs were already collecting data in a way that they could easily report out. And we could see that some programs could more easily report numbers of children served by age range or other data points. And for some of the programs, this kind of data wasn't necessarily applicable. And then for others, they were collecting data, but it wasn't available to report for some reason, which meant we'd need more conversations about that. And as we move forward with our ECIDS planning, it's been helpful to know which of the programs have data readily available and which don't. And then in addition, for this year, we embedded some data integration readiness assessment questions into our 2021 PPR template that Brittany had started sending out so that we could start to get some initial questions answered around their data integration process. And we can identify from those how to best allocate resources in the next year to support our ECIDS work. So with that, I will pass it back to Brittany to talk about some of the additional initiatives that the PPR has supported.
Thank you, Dylan. So another example is with family engagement. So for those of you who remember last year's report, there were just two questions regarding family engagement, which were, does the program use a family engagement framework? And if so, what framework? Based on a cross-department work group within New Hampshire, we actually added 2 additional questions in our program outreach. We asked programs what data they collected with family engagement, and then what does family engagement actually look like when implemented within that program. So that will help our state have an environmental scan of over, I think we're over 60 programs at this time, of over 60 programs about what family engagement really looks like in our state. I want to give one example of how our PPR has supported additional system investments. This is probably one of my favorite examples. So after we submitted last year's PPR, and as I mentioned, we always engage in that two-way street process with programs that are included, a program reached out to us to ask what other programs had identified children and families experiencing homelessness as one of their priority populations. So we pulled that data, shared it with that individual, and they were able to almost immediately identify partners to submit a new RFP for another grant initiative. We also used our PPR to increase awareness and access for families. And how we did that was the questions regarding, and the definition for vulnerable and underserved families. We took that and used it to help prioritize which programs, which resources really needed to be on our state's one-stop shop website first. And on an ongoing basis, we're continuing to evaluate if and how the PPR could be implemented beyond PDG, meaning what does it look like to make this more than just the PDG initiative. And to wrap up, I want to share just 2 lessons learned with our original approach. And then like most of you, a few weeks ago, we learned about the potential new PPR. So I wanted to share some lessons learned in our current approach, but then also some things that we're just thinking of as we look towards the new PPR. So as I mentioned in the beginning, breaking down the PPR into manageable sections for those of you who are overseeing your PPR, but also to make it so that you're not asking programs for all their information all at once. Develop applicable tools for information gathering. That could look anything like timelines, templates, those canned emails, and even having some type of project management or organization tool really helps in this process. Outreach and coordination, always ensuring that you're using that two-way street approach. I think it's essential to share the final report back with programs that participated. That could even just look like a presentation like this to the stakeholders that were included. And I know it's at the end of the circle, but I think identifying opportunities for alignment is really something that could be in the center and integrated along the way. But now what? Now what are we thinking that we have seen this new PPR? For the most part, you'll see that all of the things are the same. But I want to draw your attention to that one box on the right. Identifying alignment between data that's already been collected, existing data, and potential gaps. So as we've alluded to in New Hampshire, we've already started our PPR process for this year. We already have a lot of narrative data received from over, I think we're up to 50 programs out of our 60 have responded back with their narrative responses. So we already have this data. So thinking about how it can connect to the new PPR. Also thinking about what other existing data. So for example, do any of your programs in your mixed delivery system do an annual report, or did they just do an update on the impacts of COVID for their program and the families and children they serve? So what's already existing that can connect and support the new process? And identifying gaps. We understand that there's always room for growth when it comes to data. So thinking about what are those gaps? Who do we need to bring to the table who may have not been there before? And then thinking about how we can leverage our strengths as a state to overcome and mitigate any gaps that we have. So those are our lessons learned for what you can think of for if you're using an approach similar to last year's PPR, or if you're thinking about the new PPR process. So that concludes the presentation for how New Hampshire is using our PPR as a tool for our state. I have left our email addresses up on the screen. I will be your point of contact for PPR and how New Hampshire is using it as a tool. And then Dylan is your go-to for all things connecting your PPR to your strategic plan and data integration, specifically within New Hampshire. So thank you.
Great. Thank you so much, Brittany and Dylan. That was such a great presentation. Thank you for sharing your processes with the other states. I love the two-way street approach. I think that's very critical, and just identifying the alignment and the gaps. I think it's just a great approach, and really appreciate the two of you sharing that today. So we are going to move into breakout discussions. And we are, Mandy, you want to move up to the questions? So what we're going to do is we're going to have 4 breakout rooms. And when the breakout rooms open, you're going to see that one breakout room is going to discuss questions 1 and 2. The second one is questions 3 and 4. And then we're going to have questions 5 and 6 and questions 7 and 8. So we're going to go in the breakout rooms and just kind of talk about what kind of data, what sources of data you may want to use to respond to the questions. And basically, if you have any other thoughts on the questions, we definitely are going to welcome that input as well. So, and we will be in the breakout rooms probably about 15 to 16 minutes. So let's go ahead and open them up. And just, we will have time at the end for people to ask the presenters questions. So you should be able to pick your breakout rooms now.
I'm just realizing that the questions are in white and they're not showing up correctly. Sorry. One more second. I am getting there for you, I promise.
No problem. Take your time.
Okay. You know what? Let me just share my screen. This is easier. I don't know why I'm doing it this way.
Perfect. No problem at all.
Okay. So here's 1 through 4.
Okay, great. Thanks.
And then let me show you 7 through 8.
Okay, perfect. Thank you so much. This is very helpful.
Okay, good. Anybody else need help?
Right. All right, now everyone's here full force. Very good. I hope you guys had a great conversation in your breakout rooms. And so we're hoping to be able to have some sharing time so we can hear from what each of you all talked about, since we had different questions. We could start off with questions 1 and 2, which was my room. And I'm not sure if anybody in my room wants to share, but we had a bunch of newbies in our room. We had a bunch of states that this will be the first year that they have to do the APPR. And so it's a brand new experience. And then we also had someone from New Hampshire. So we had a pro, and then we had a bunch of newbies. And I know it was really hard for them to not pick Meredith's brain and get all of the details. But I think it's really interesting. One of the things that one of our participants shared about was thinking about what data already exists and is available, and then building that relationships, to continue to get the data that's needed. And I think that just goes back to that we know that the work that we do is very focused on relationships. And so I appreciated her making that comment. For group 2, the breakout room, you guys discussed questions 3 and 4. What were some of the ideas that you all shared and talked about in your room?
So we were similar. I had Brittany from New Hampshire and some folks who were just getting started. So we spent a few minutes taking a collective sigh of relief around the really true appreciation for this new format. And then dug into the idea of a crosswalk and going back to the beginning, the first application, needs assessment, strategic plan, and finding all the places that you could look back on to see where you started and how far you would come. So I don't know, my group you can jump into, but.
That's awesome, Mandy. Thanks for sharing. Right, and then our next group is in the next set of questions, 5 and 6. And I think that was your group, Missy.
Go ahead, Wendy.
Okay, so as it relates to quality, we talked about a data source. Obviously, obviously there's the QRIS efforts in terms of data, but we talked about the difference between that kind of system level, provider level information and, what families might see as quality. And so, we were talking about maybe the differences between in Nebraska in our needs assessment in the second round. We got deeper into the more at-risk, marginalized people. And one of the things they saw as quality was whether or not the provider was, culturally informed. And so are we taking those kinds of things into account? And then under 6, in terms of maximizing family and parental choice, an idea that was talked about was related to surveys that might be conducted as part of the parent education campaign to learn whether or not those education campaigns have been effective in increasing a parent's ability to choose and their knowledge and engagement. So that's some of the things we talked about.
That is great. Thank you for sharing. Sounds like you guys had a great conversation in there about some real strong data sources. Awesome. And then we had our last groups, questions 7 and 8. And I think, Stephanie, that was your group. What were some big ideas that you all talked about?
So I'll just talk briefly about question 7, and then Dylan is going to talk about question 8. Our Chris was with us and he had to step out. So with 7, we talked about just kind of what they were doing in their state and some of the things they thought that they could kind of measure, one is the stakeholders that they're bringing together, and the ASQs that they'll be with the children, kind of count, seeing how many children are being assessed with the ASQs and what types of different resources that they're providing to the children and families. And yeah, I think that was it. So, and then I'll let Dylan talk about question 8.
Yeah, so for question 8, I think a lot of what we talk about is probably some of the things that I mentioned in the presentation with our data integration planning and our ECIDS. But this year, like specifically one thing New Hampshire did too was make a lot of progress with its rainbow diagram. So that's a specific thing we could point to. And then we also are making some progress with our data governance structure as well. So that's another piece that we'll probably discuss there.
That's excellent. Well, I really appreciate everyone participating in the breakout rooms. I think it's a great opportunity for connection and for being able to hear what other states are doing, like meaningful activities and lessons learned. So we appreciate New Hampshire's sharing about theirs and then going into the breakout rooms and being able to connect. I'm going to turn it over to Mandy.
All right, thanks, Faith. So I'm going to introduce our next presenter, who's going to share a little bit about their alignment work. So Dr. Morgan Crossman is the Executive Director of Building Bright Futures, Vermont's Early Childhood State Advisory Council, and serves as the primary advisor to Vermont's Governor and General Assembly. Dr. Crossman is also the director of Vermont's Early Childhood Resource Data and Policy Center and holds a faculty appointment at the University of Vermont in the Department of Education. And she just got here, so she had perfect timing. And she's going to share her screen and talk to us about some of the cool things they've been doing with data and strategic plans in Vermont.
Thank you, Mandy. I am sorry for being late. I was just in a really incredible meeting where we had 20 plus early childhood data stewards from both our state agencies, our private partners, and our academic partners coming together to start the conversation around a data development agenda for early childhood in the state of Vermont. So I am thrilled to be here today talking about early childhood data in the state of Vermont. And I just want to quickly note what Building Bright Futures role is in Vermont's early childhood system. So we are, again, the primary advisor to the governor and the legislature, but our work is really about improving the well-being of kids and families in the state and using evidence and data to inform policy. And one of the critical points for folks to know on this call as we think about the preschool development grant is that BBF's role in Vermont's statute is to hold the vision and strategic plan for the early childhood system. And that vision is to have an integrated continuum of comprehensive, high quality services that's equitable, accessible, and will improve outcomes for each and every child in the prenatal period to age 8. I do want to tie this together with our PDG activities and say, Vermont received a 1-year planning grant through PDG, which is building on 10 years of state and federal investment in Vermont in thinking about how we support the early childhood system. So I want to walk you through a clear example of how those PDG activities culminated in Vermont Kids Data, which is our new resource data and policy center for the state of Vermont. So what you're seeing on the screen right now is the visual representation of the findings from Vermont's early childhood needs assessment. And I won't go through all of the different components, but I want to highlight the data quality theme. So within high quality data, we heard not just that Vermont collects a range of data across our system, but that we can't always answer the questions we want that allow us to inform decision making, and that there's no centralized place to monitor that data and outcomes. So we really needed a centralized data solution to be able to look at what data exists, what are the limitations to that data, and how are we actually using that data to prioritize the gaps and move forward our early childhood system. One exciting piece about this high quality data section of the needs assessment is that it also resulted in an 8-page data gaps table, of the things that we feel like we can't yet answer and want to be able to about different components of our early childhood system. So that's something that's really been prioritized in the state of Vermont through our strategic planning committees. The second major deliverable in this preschool development grant was the update to our strategic plan, which in Vermont we call the Vermont Early Childhood Action Plan. So what you're seeing on the left-hand side of the screen is the 4 goals we've identified and how it maps to an ecological model for how we think about keeping children and families at the center. And so the one that I'm really going to talk about today is goal 4, that the early childhood system will be integrated, well-resourced, and data-informed. What's exciting about this work in Vermont is not only do we have all of these different goals, but we have committees dedicated to monitoring progress on those goals. So we have 7 different committees that come together at least 6 to 8 times a year to be monitoring progress towards these goals. Some of them are grant funding committees, but they are all staffed by Building Bright Futures, but also supported by public and private partners. And the one that I just came from is the Data and Evaluation Committee, where folks are really excited about our data development agenda and thinking about how we're consistently monitoring evidence and data to inform policy. So I'm going to take down my slide share for just 1 second and move to showing you the data dashboard that we've developed to monitor our strategic plan. And what's really exciting is that this iteration of the strategic plan for the first time has not only goals, outcomes, and strategies to support how to move the work forward, but we have indicators to monitor progress. So we built the data center as the place to centralize all of this information, the resources, the data, the policy recommendations, publications across all of our different stakeholder groups for what we know about early childhood. So what I want to show you today at Vermont Kids Data is the Vcap data dashboard. So you'll recognize the ecological systems model and the 3 goals of our strategic plan. And what I want to show you is that if you click on one of the goals of our strategic plan, the example I'll give today is goal 3, all children and families have access to high quality opportunities that meet their needs. You can scroll down to some of the key outcomes or domains that we're looking at. If you were to navigate to development and education, you can scroll down and see all of the indicators for how we're trying to monitor progress towards these goals. I'm not going to show you all of them, but I do want to navigate to a couple of them. The first is childcare. So of children who are likely to need care, 62% of infants, 27% of toddlers, and 30% of preschool age children do not have access to full day, full year regulated childcare programs. And that's for 2020 data. We're actually in the process of updating this data right now, and we'll have that coming into the legislative session this year. So alongside being able to look at childcare data, we can also look at, for example, universal pre-kindergarten education in the state of Vermont. And so this data also is not updated yet for this year's educational session. But across all these indicators, we're able to live pull data in some cases, whether it's from the most recent update to the national survey or partners at the Agency of Education, whoever that primary data steward is for the state of Vermont. So the example here on universal pre-kindergarten education enrollment is a really interesting one. So in the state of Vermont, it defines what it means to have universal pre-kindergarten education right now, which is 10 hours a week of publicly funded pre-K for 35 weeks of the year. And we are seeing a dip in enrollment during COVID. So what does that mean and how do we talk about it? And what are we going to see in this next year of trend data? We also have data on, for example, the percent of children ready for kindergarten. We also have reading proficiency, 3rd grade math and reading. So that's one way that we have compiled some of this information to be able to share with all of the early childhood partners and our legislators. And I want to give one more example before I wrap up. But if you were to look, for example, at our mental health indicators, and scroll down to the percent of children with a mental, emotional, or behavioral health condition, we'd see that 1 in 5 children ages 6 to age 8 currently falls into that category. And this data is actually pre-COVID. So this data and this indicator is one that we've consistently been monitoring to see what this looks like as we navigate the pandemic. Two of the others that are interesting in this area is also the number of children who are served, for example, by our designated mental health agencies, and looking at that kind of consistent trend over time and increasing utilization. So again, this is not documenting the need necessarily, but utilization. And the final one I'll show you is the number of children receiving crisis services. And this again is not updated with the most recent next iteration of 2021-22 data, but that is forthcoming in the next few weeks. So I'm really excited to talk with you a little bit more about this dashboard, answer any questions. And the last thing I want to highlight, not in the data dashboard, but in the publication section, is how we're trying to build a really robust repository of all of the different publications, resources, and supports that our partners in the state of Vermont, but also nationally, are producing as it relates to all of these different topics. So again, using the pre-K example, you'll see the links to all of the official documents in the state of Vermont, some of our national partners' publications on pre-K, anything that we in the state of Vermont have produced from the Department of Education, and Building Bright Futures. So really exciting to see this work come together under year one of the preschool development grant, and really working towards how we build this prototype for centralizing early childhood data, making it publicly accessible, and ultimately moving towards an integrated early childhood data system in Vermont.
Well, thanks, Morgan, for just walking in and presenting 2 minutes later. That was great. I think your example really brings home the idea from Richard in the beginning about how this is a continuous process and doesn't start and end with just PDG. You've shown how you continue to use your strategic plan after the grant is over. I think Brittany and Dylan showed us how they're getting ready to create all of these alignments. And then you showed us an example of how it can be done as a dashboard. So we have 15 or so minutes left. So does anyone have any questions for any of the presenters? They're all still here with us.
Thanks, Pauline. I like that quote.
Mm-hmm.
So Morgan, I have a question for you. What was particularly interesting to me, and maybe to some of the other participants here, is even though Vermont did not get a renewal grant, you were able to make progress on the work that had come out of your first year planning grant. Could you talk a little bit more about how that came about? Like what allowed you, or how was this progress able to be made?
That's a great question. And it's really great to see you, Richard. It's been incredible. So I have been in this position now as this primary advisor for about 2.5 years in the state of Vermont. And one of the things that I have loved about returning to my home state is that folks are able to do so much incredible work through really intentional collaboration, and are seeking a multiple sources of grant support to fund different components of the work. So the fact that we've had a series of federal funding opportunities for the last 10 years dedicated to early childhood set the tone for how we build, for example, the strategic plan. So the PDG opportunity, that 1-year planning grant, was our opportunity to update the strategic plan, not build from scratch, which I think is a really important point to know. And it's something that we want to maintain and consistently hold in the state of Vermont moving forward, regardless of what the federal funding looks like. And that's actually a role that Building Bright Futures plays in statute, which I think may be a little bit different than some other states. So I would say we in Vermont have a really strong commitment to early childhood, both from a federal and a state statute perspective, where BBF, as this neutral public-private partnership, holds the strategic plan and vision, but also in terms of how we are seeking out other opportunities to consistently build on what we've started under some of these federal opportunities. So PDG in that planning grant year was a really incredible opportunity for us to set the tone. And now we're consistently seeking additional funding opportunities to continue to build and use everything under PDG as that vision and strategy to move forward as a catalyst for the rest of the work.
Okay, and then my follow-up question to you is, if I am a state listening to this presentation and looking at this amazing site, I love it. I want to try to get one too. But where do I start? How did you get started? What were some of the initial steps you took to create such an interactive tool?
Also a great question. So I know that Mandy talked a little bit about my background, but as a PhD trained researcher, I am consistently thinking about how we use evidence and data to inform policy. And I think what we tried to do was reach out to our stakeholders, and not just the folks on the ground, but also our legislators, our state agency leaders and representatives, and say, we collectively identified this as a critical need in the state of Vermont. We have no way of centralizing this information, and it's urgently needed for us to be able to inform decision-making. The preschool development grant was one opportunity to be able to fund that work, but we also had to elicit additional funding applications for this through both private philanthropic funding, but also from the state of Vermont to say this is what's needed. We also pulled together, as I mentioned to you before, this data and evaluation committee through the state of Vermont, which is, again, public and private partners coming together to say, this is what data is critical. These are the major questions we have. And here's what would be most helpful in a website like this. And we started there. What is the need? How do we fill that need? And let's build the prototype as the initial base platform for how we could do this work well. And that's where we are right now, seeking additional funding to more fully build this platform out so that eventually it can be used as the starting point for what folks have talked about on this call as this early childhood integrated data system, right? That this is not the gold standard for the back end of how you do this data work well, right? This involves a lot of work from a separate entity to go out and pull the data into this platform. And what we need to move towards is building the optimal, how do we have this consistent feeding of information into the platform so that we can then produce the data that's necessary. And I'm also seeing a comment in the chat about who's the intended audience of this site. And that's also a great question, Meredith, is we tried to build it similar to the model that Building Brief Futures is modeled on, right? That it is for public and private partners. So we want state agencies to be able to access data across sectors that they need. We want parents, educators, and providers to be able to use data from this site or reference policies and publications from our early childhood system for grant reporting and grant writing. And we want our legislators to be able to go here and say, okay, I have this question on universal pre-K. Where's the one-stop shop for where I go to say, okay, I know I can find data and links to all of the other things. Even if the data isn't here on this site, we make sure that we're trying to link to where they can find additional information and who are the points of contact. So again, trying to build that baseline, and it still really needs additional resources and support to build out to be the true vision.
Thanks so much, Morgan. And I have a question for Brittany and Dylan. Hearing from that a lot of the people in this session were really new to this or beginning to look at what they're going to do next. You talked about all the different pieces you started, but if you didn't have someone like you, Brittany, who had the time initially to get working on it, et cetera, and Dylan, where do you start? Like, if here we are now, if someone hasn't started yet, what should be some of the first steps they take to get started? It could be either of you.
Yeah, I would say the best thing that you can do, and I feel like it's come up multiple times throughout this entire meeting, is build relationships. Because if you have that relationship, you could show up and say, look, these are the questions we're trying to grapple with or answer, whether you're looking at, actual data or if you're looking at those narrative questions. And build a relationship to say, how can we partner together to answer these? And I think that's just going to make it easier for the PPR, for your state strategic plan, and anything else. And because I had been part of our state before, I already had those relationships and was able to leverage them. So that would be my top recommendation, is to build those relationships. And number two is, I would say, look to either data that already exists. So what, if your state's already has something like Vermont that has this data repository, what in there aligns with the new PPR, or even look at last year's template and start to think about what you can pull from. Just remembering that you're not starting from scratch. So those would be my two top things. Dylan, I don't know if you have any other thoughts.
I think Brittany's our PPR champion at this point, so I think she summed it up pretty well.
I want to give other people a chance to ask questions, so I'll be quiet for a moment.
Anyone else? I didn't see, I can check the chat one more time. I don't think I saw any other questions in the chat.
Mandy, can I jump in and ask a broader question to states, and recognizing that I have not been here all day, so I apologize, but one of the things that I have been really excited about is thinking about how we leverage grant opportunities, not just for the purposes of grant deliverables, but how we actually take this work and ingrain it in the infrastructure in our states. And I'm just wondering if other folks have found that really challenging, if there have been some unique strategies for how to do that well. I think that Vermont, we have a unique position where we do bring the public and private partners together every single month to hash it out and really be intentional about those relationships to make sure that that is the vision and that we're moving in the right direction together. But I'm wondering if that's the same for other states where you may be struggling to see funding come in and there are specific concrete grant deliverables that have to be achieved, and how you integrate those into the rest of your work.
I promise I didn't plant that question with Morgan. It was like, that's like a spot on question for this presentation, Morgan. Do we have any thoughts on their work trying to do that?
I can share. I know that we covered this a little bit in our presentation, but the way that I look to describe even just like my role within our state agency is like creating spider webs, basically, of like, if you can connect initiatives to each other, to bigger goals, then obviously, yes, everything's going to have its own specific data or requirements, but it's going to be connected to something bigger. And I think that's going to keep something from falling apart, as it's no longer just one grant, but rather it's system and people in that system that are connected. So like Mandy's visual of nature earlier, I'd go back to nature and say, make everything just a spider web and connect to as much as you can.
Yeah. Well, and hopefully as you all dig into your APPRs, assuming we move forward with this new format, I think it will help you create that spider web or see your infrastructure and see how the activities, your buckets, your trees are hopefully leading to changes in the bigger system and how it can continue on. I kind of see our numbers dropping, which makes me think maybe folks are going to go take a little break before the next session. So I'll share our last slides here to make sure that everyone has seen all these resources. So here is the PDG B-5 TA Center website. We offer lots of briefs and toolkits and information here. You can also get signed up for our newsletter, where we provide information on webinars and work groups and upcoming activities. Another great place for resources and connections is the researchconnections.org, where you can find all kinds of information on a variety of topics, including stuff we've been talking about today, coordination and integration, finance, data systems. So if no one has any final thoughts or additional questions, I'm glad everyone was able to come today. I hope we can see you all at, oh, go ahead, Richard.
I was just going to add one other comment. If folks are coming to the closing session, I will talk a little bit more about the APPR, just in case you had other questions about the the connection between the previous version and the revised version. But also just remember that what we're trying to do here, just want to kind of reiterate this, that there's going to be APPR office hours that you can come to. There's going to be a webinar in November on the PPEP. So if you haven't done that yet, or you're working on that, there's a lot of opportunities that the TA Center and the TA staff provide to you, as you know already. Take advantage of those opportunities. And the other thing I was going to say is just that, remember, in changing this version, even if you didn't have to do the previous version, in changing this version, the whole idea is for all of those questions probably should start with using data to support the answer to this question, answer this question, right? So then you can talk about whatever data you're using or collecting or working to collect to answer that information. So all the questions are tied back to data, but it allows you to tell the story based on where you are in your state and that state's development of work. And those of you who found last year's Excel spreadsheet to be useful, absolutely keep using it. You can submit your information in any format you want to support the answers to those questions. So in no way do we want you to stop using the tool. Remember what I said at the beginning of this session. Regardless of the requirements that you're submitting to us, this is really about you moving your state forward. And so if tools are helpful, if resources are helpful, if last year's tool, even if we're not using it this year, is helpful to you, continue to use it. Modify it to meet whatever needs you have or to collect data that you want to collect if that's the method to go to. So I would just leave you with those thoughts in all the work that you're doing. Just thank you for participating in this. This is important thinking. And as you've heard in all the sessions, at the end of the day, it's the data that's going to support everything that you're trying to do and all the stories you're trying to tell. So thank you very much. Thank you, Mandy, for giving me extra time to talk.
No problem. All right, see you all in a little while at the closing plenary. Thank you.